Assalamu alaikum. In this lecture, we're going to talk about two cranial nerves. One is the glossopharyngeal, which is cranial nerve number 9th, and another one I'm going to talk about is going to be vagus nerve, which is cranial nerve number 10th. So, as I told in my previous lectures, that whenever you're covering any cranial nerve, there are fewer headings that you need to cover. That includes the nuclei you need to talk about, then you talk about the roots of them, and then you talk about the emergence from where that nerve is emerging from the CNS. Then we talk about how it's going to have its intracranial course, and then it's going to exit the skull from whatever foramen or fissure. And then we have to talk about the extracranial course and its termination, and obviously about the branches and functionality. So I'll be covering these headings for glossopharyngeal and vagus nerve in this lecture. So first, let's talk about glossopharyngeal nerve, which is cranial nerve number 9. So when I talk about first the nuclei, so the cranial nerve number 9, which is glossopharyngeal nerve, this nerve basically has three major nuclei. One is basically known as the main motor nucleus. The other one is known as the parasympathetic nucleus, also known as the inferior salivatory nucleus. And another one is basically the sensory nucleus, which is known as the nucleus of tractus solitarius. So all these three nuclei you can clearly see in this picture. If I just show you here, this is basically the nucleus of tractus solitarius, which is basically the sensory nucleus of uh, the glossopharyngeal nerve. Then we have the parasympathetic nucleus, also known as the inferior salivatory nucleus, which is right here, anterior to the previous nucleus, which is the parasympathetic nucleus of the glossopharyngeal. And then right anterior to that, we have a main motor nucleus of the glossopharyngeal nerve. Now, this basically suggests that my glossopharyngeal nerve is definitely a mixed type of nerve, which will include three types of fibers: the sensory fibers coming from the sensory nucleus, the motor fibers coming from the motor nucleus, and some parasympathetic fibers are coming from the inferior salivatory or the parasympathetic nucleus. Now, let's talk about further about these nuclei. If we talk about the main motor nucleus, the main motor nucleus right present, it lies deep to the reticular formation at the level of medulla oblongata. This is a cut section shown of medulla oblongata. You can clearly see the inferior olivary nucleus. And then when you talk about the connections, the corticonuclear fibers from the cerebral hemisphere shown in green in this diagram are basically connecting this main motor nucleus. And from there, the efferent fibers, they go and they supply the stylopharyngeus muscle, which is one of the muscles of the pharynx, which we'll cover later, or you must have covered in when they taught you pharynx in RESPO module. Then we talk about the parasympathetic nucleus or the inferior salivatory nucleus. Now, this nucleus is present just posterior medial to the main motor nucleus, as you can clearly see here. And this is also present at the level of medulla oblongata, and as far as the connections are concerned. So the autonomic pathway, it descends from the hypothalamus and finally reaches this nucleus, that's inferior salivatory nucleus. And from there, the efferent fibers, they go to the glossopharyngeal nerve. And furthermore, there, as shown in green in this diagram, the line which is coming from the nucleus of tractus solitarius, they are also interconnected together, and these fibers are coming from the nucleus of tractus solitarius into the parasympathetic nucleus of the glossopharyngeal nerve. Then we talk about the sensory nucleus. Sensory nucleus is also known as the nucleus of tractus solitarius. This is a little bit posterior, a little bit posteriorly present to the inferior salivatory nucleus, and this is also the level of medulla oblongata. And as far as the connections are concerned, the afferent fibers, they're coming from the carotid sinus, which contains the baroreceptors responsible to sense the blood pressure of the internal body. And then as far as the efferent connections are concerned, they're coming from the nucleus of the thalamus and hypothalamus. The sensory nucleus obviously तो ये thalamus पे लेकर जा रहा होगा because sensory tract है, और obviously जो उसके afferent fibers, they're coming from the carotid sinus, which are the baroreceptors present in the carotid body. Now, as far as the roots and the emergence are concerned, the root is basically obviously it contains since it has like three major nuclei, so these roots are coming from these nuclei. So majorly, if you clearly see the glossopharyngeal nerve overall, so it contains the fibers from the parasympathetic nucleus, that's inferior salivatory nucleus. Uh, Similarly, they take the fibers which you can see in pink, they're coming from the main motor nucleus. Along with that, we have the fibers coming from the nucleus of tractus solitarius, which you can clearly see in blue. And furthermore, if you clearly see, there's a superior ganglion of the glossopharyngeal nerve, which is also present within the parenchyma of the glossopharyngeal nerve itself. And as far as the emergence is concerned, you must have covered brainstem by now. So you know that the glossopharyngeal originates from it is the superior most emerging from the junction between the inferior cerebellar peduncle and olive. As far as the course is concerned, right after the emergence of the nerve, it runs laterally to the in posterior cranial fossa, and then it exits the cranial cavity by passing through the jugular foramen, which you must have known when we taught you skull, and it reaches destination. Now, as far as the glossopharyngeal is concerned, it since it's a mixed nerve, it has motor supply, sensory supply, it has parasympathetic function. Motor supply, it supplies the stylopharyngeus muscle, so it definitely goes there. Then, as far as the sensory supply is concerned, it takes taste sensation from posterior one third of the tongue, as well as it takes taste sensation from the soft palate, and as well as I just told you earlier, that also is responsible to sense the blood pressure through the carotid sinus. And as far as the parasympathetic fibers are concerned, they're responsible for the salivation from the parotid gland. So it's also supplying the parotid gland. Moving on to the vagus nerve. Now, vagus nerve is the 10th cranial nerve. We're going to cover exact same headings for that. So let's start with the nuclei. Now again, vagus nerve is also a mixed type of nerve. It also has three nuclei. It has a main motor nucleus, which you can clearly see here. Then we have the parasympathetic nucleus, also known as the dorsal nucleus of the vagus. That is right here, posteriorly. And just next to it, we have another nucleus, which is also known as the sensory nucleus. It's the lower part of the nucleus, tractus solitarius. So remember that glossopharyngeal and vagus, they share one nucleus, which is the nucleus of tractus solitarius. The superior part, the fiber coming from the superior part, they go to this glossopharyngeal, while the fibers coming from the inferior part of the same nucleus, they become part of the vagus nerve. Now, the main motor nucleus, as you can clearly see, it is present again, it's present at the level of medulla oblongata, and it again lies deep to the reticular formation, and it's majorly formed by the nucleus ambiguous. And as far as the connections are concerned, you can clearly see in yellow lines that are coming from cerebral cortex, and these are the corticonuclear fibers from the cerebral hemisphere. They reach to the main motor nucleus of the vagus, and from there the root goes ahead. As far as the efferent fibers are concerned, supplies the constrictors of pharynx and intrinsic muscles of the larynx. So remember, the motor component of the vagus nerve is responsible to supply the intrinsic muscles of both pharynx as well as the larynx. Then we have parasympathetic nucleus, which is present on the posterior aspect, which is also known as the dorsal nucleus of the vagus, and it is just present posterior lateral to the hypoglossal nucleus. You can clearly see it. And then it's connected to the autonomic nervous system, autonomic pathway coming from the hypothalamus, as well as the fibers they finally enter into the glossopharyngeal nerve. They are also connected together. The sensory nucleus, obviously, the sensory is going to like receive information from the periphery, and then it's going to give it back to the thalamus. And they are present just so it's basically the lower part of the tractus solitarius, so the location is exactly the same. And efferent connection, the fibers are coming from the nuclei of the thalamus and hypothalamus. So we talk about the root are exactly going to be the similar. They're going to be similar to that of glossopharyngeal nerve, but as far as the emergence is concerned, emergence is exactly the same. It emerges from the junction between inferior cerebellar peduncle and olive, but just inferior to the glossopharyngeal nerve. As we talk about the course, please remember vagus is the longest cranial nerve we have. It goes as low as it can reach up to the upper side of the abdominal cavity. And the moment it emerges from the inferior cerebellar peduncle and olive junctions, The moment it basically exits again the cranial cavity by passing through the jugular foramen and finally reaches the destination. In this diagram, you can clearly see that on its way along, it descends downwards, enters into the neck, then finally enters the thoracic cavity, and then finally pierces the diaphragm, and finally reaches the upper part of the abdomen. So basically, anything which is coming along its way is going to supply that. For example, it's going to supply the larynx, it's going to supply, it's going to make a cardiac plexus, it's going to make pulmonary plexus, bronchial plexus, esophageal plexus, gastric plexus, celiac plexus. It's going to turn left and supply the spleen. It's going to go down and supply the kidneys. It's going to turn to the right and supply the liver, forming the hepatic plexus. So these are the list of organs. This is the list of organs that are supplied by vagus. So when it comes to functionality, the vagus nerve, as far as the motor supply is concerned, supplies the constrictors of the pharynx and intrinsic muscles of the larynx, which I just told you earlier. As far as the sensory supply is concerned, it takes sensation from pericardium, pleura, and peritoneum. And as far as the parasympathetic functions are concerned, it controls the involuntary muscle, the GIT. So this was all about glossopharyngeal and vagus nerve. I hope it is clear to you. If you have any question, you're free to ask me. Thank you so much.